patient is a 46-year-old male who suffered a traumatic brain injury 23 years ago. His goals include being able to use his left arm and walk better. Postural examination reveals a forward head, slightly rounded shoulders, and a posterior pelvic tilt. A flexor synergy affects the tone and function of the left upper extremity. This limits range of motion of the entire extremity and affects functional use of the hand.
Passive range of motion, then active range of motion.
The arm and hand cannot move against gravity, and there is no movement out of synergy. On the modified Ashworth scale, the patient rated 3 out of 4.
And you can see there's steady resistance to me trying to straighten.
There is decreased sensation, including proprioception on the left side secondary to the brain injury.
Computer, go ahead, go back and forth.
Coordination testing on the left is not performed, owing to a synergy dominance. Coordination on the right is intact.
Good.
Owing to decreased strength and sensation and increased tone on the left, the patient is unable to maintain balance in tandem and single limb stance. He experiences difficulty with weight shifting during step-ups.
Okay. We'll do that for 30 seconds.
Difficulty was experienced maintaining balance during conditions 3 and 4 of the modified clinical test of sensory interaction and balance. Here, the patient's balance strategies are examined. The patient is able to recover from large perturbations in sitting position, but is unable to display effective protective extension on the left. On the timed up and go test, the patient gets up without using arms and completes the test in 7 seconds.
And go.
With the addition of a cognitive task, completion time increases considerably to 20 seconds. Following a brain injury, both ambulation and balance require increased attention. The patient may be at risk for falling when performing a motor and cognitive task simultaneously. Walking speed is 0.97 meters per second. Gait abnormalities include decreased weight bearing and stance time on the left leg circumduction and lateral trunk lean, and no push-off. These deviations are more pronounced as walking speed increases. When performing a quick pivot turn, the patient makes an exaggerated correction, indicating poor proactive balance. Difficulty is experienced with changing step height and length to step over an obstacle. Testing hand function indicates abnormal flexor tone predominates, making it difficult to open fingers and grasp objects. Normal and fast-paced weight bearing, foot position, step length, and cadence are examined using a gait right mat.